Good morning, everybody. I want to welcome everyone today on behalf of the Washington chapter of the American Academy of Pediatrics. I'd like to thank you for joining us really bright and early on this summer morning. My name's John Dunn. I'm the chair of the vaccine committee for the Washington chapter. I'm a practicing pediatrician and head of the immunization program over at Kaiser Permanente, Washington. And I am very excited and pleased to be able to present our guest this morning. The person who will be speaking with you today is Dr. Jeanne Marconi. She's a longtime practicing pediatrician and who works now as an educator and consultant in practice management. She focuses on encouraging primary care groups to integrate innovative new ideas and specialty services into their own practice. This has included concepts like in-house urgent care, infant maternal breastfeeding services, early health and wellness, promotion of nutrition, services for evaluation and treatment of conditions such as asthma, obesity, head injury, ADHD. Pertinent to our recent challenges with the COVID pandemic, her recent work on early telehealth adaptation to wealth care and her long history with drive-thru flu clinics have received national attention, and it's the latter one in particular where I think that she has a lot to offer us and a lot that we can learn. Dr. Marconi, I'm pleased to welcome you today, and I will let you take this away. Thank you so much for coming.
Thank you, and I really appreciate all of you getting up so early to learn about vaccine drive-through clinics and how we can make this process more expedient for you and your staff and efficient and convenient for the patients. And I'm happy to take questions. I think John will assimilate them, so you can use the chat option on the bottom to post your question. And if we don't get to all of them within the session, I'll be happy to respond to them after, and we will share them with everyone. There also will be two handouts that I think Ariana will also post at the end of this. One is a checklist, and the other one is a suggested form that you might share with your landlord for the license to be able to do this into your parking lot. So I think we will get started. All right. You know what, Ariana, my slide, let me see. Okay, there we go. Sorry about that. Okay, so today we're hoping that physicians and staff will be able to learn how to develop, prepare, and implement a vaccine drive-through clinic in your practice. And honestly, I think as long as you have somebody detailed working on this, it really shouldn't be that much of a challenge for most of you. We also want to be able to, follow through to use this potentially for when we do get a COVID vaccine, as we will be needing to probably immunize large numbers of people in a very short period of time. And as we know, children will probably be last, but it will be available to them at some point. And then, to use this idea to maybe think about doing some of the other services that you have in a different way. Even with telehealth during high COVID, we were able to do parts of the well checkup in our parking lot. We were able to do second HPV vaccine. So hopefully you can use this as a platform within your practice to expand some of the services and be able to not miss opportunities to take care of the children in your practice. So historically, we all know that we have been given vaccines in the office with an office visit. So if they were in for a sore throat or something else and it was flu time, you would vaccinate them. We have all probably done the nurse-only visits where you have one nurse who's running the vaccine clinic for the day or a shift, and then we have this new option now of drive-through visits. So why do we want to consider drive-through? It's efficient. People don't have to get out of their car. You don't have people waiting in your waiting room. They're not tying up your front desk staff who could be working on other tasks. It's very quick. And it is enhanced by, our current COVID pandemic. But to be honest, we have been doing drive-through flu clinics for about 18 years in our practice. And It was prompted to me when we had in one of our supermarket, shopping, parking lots, this kiosk open, which was like a coffee place. It was before the Starbucks drive up and, dating my age now, unfortunately. But, there really wasn't this idea of, drive-through. And I thought, wow, could we do a strep drive-through? That was my first, which of course, really wasn't a very good idea, but it rang a bell to me that we could do something in medicine in this like sort of drive-up model. And that's when we started doing flu vaccines. And initially the parents were like, you're going to give a shot in like a parking lot? Or the nurses were like, oh, you're going to make us stand in the parking lot? And honestly, after the first year, we had no issues with uptick. I mean, we basically open up the sign-on or scheduling online, and we would be filled that day. So we couldn't keep the slots open fast enough. And, now with a lot of information and historical data, we know how many we need to run. And, so we open up more than a couple at a time. And we'll talk about that in just a little bit. So adapting flu vaccine, now in the age of COVID, it makes it a little bit different than what we've been doing before. But, we know that the ACIP wants us to have flu vaccination completed by October 31st. So, although it's sort of been a recommendation to do it sooner rather than later, they are really targeting that we get this done between September 1st and October 31st. And, how do you get that all done in your practice without, having to tie up exam rooms and, take you away from doing the other things that you need to do, and especially some of the catch up from the prior months where, people are starting to come into the office. We also want to decrease the exposure, and it's not necessarily the exposure to the patient, but to our staff. Having multiple or lots of patients coming in and out along with their caretaker is just more exposure to your staff, and you don't have this sort of endless realm of staff to be able to function in your office should they become exposed or actually have disease. You want to try to do, this is a trial run, as we know that we will need to mass distribute a COVID-19 vaccine, and who is going to end up doing that, we sort of don't know yet from a health department point of view. Sorry about that, slide's taken off by itself. So, this would be a good opportunity to do a trial run and kind of work on your workflows and do tweaks as you see that you need them, because every office is probably going to do these a little bit differently, although the recipe and the tasks are pretty much the same. And, where are you going to be able to hold these clinics, can also be problematic for some people. They may not have the right parking lot. We're going to talk about that in a little bit. For practices that don't have parking lots or in, tall buildings, you can actually do sort of a pop-up clinic either in the lobby or in your waiting room, where it can be like a quick, two-stop visit, where one is you kind of check in quickly, do your COVID questions, and then get a flu shot. So there's no waiting or waiting for a room and things like that. So there's even ways to adapt this to your environment. And then, contingency plan. What plan do we need? So, we have weather situations that might come up. So you want to be sure that you have a backup plan. My staff have done, we do a pop-up tent, and we'll talk about that in a little bit. And they've worn slickers for, mild rain. And then if it's really like nor'easter kind of things, we kind of move it into the lobby so that, again, it's a quick in and out, not a lot of waiting around. So I think one of the things about being successful in any new project service that you add to your practice is assigning a project champion, and also making sure everyone knows who that person is. So, choosing someone who is a self-starter, somebody who can, problem solve, is a multitasker. So it may not be your office manager. It may not even be your nurse manager. There may be somebody who's more apt at, you know, being able to facilitate multi-step things and kind of a get the job done kind of person. And then surrounding them with detailed people who can move other employees to also get the job done. And it goes without saying that even though certain people might be performing the functions in your practice, your whole practice really needs to know what it is you're doing, because they're going to be the people on the phone. And if they don't really know the flow and how it's working and how the sign up is, and it's not going to be a smooth process. So before you even run one of these clinics, I would roll it out to your own staff, sort of like a marketing session, like you would market it to your own patients. You know, this is what we're doing. These are, you know, the workarounds. This is how we're going to schedule, because you can run into issues of double scheduling. So if you're posting slots online and someone in the office is also not aware that they're supposed to move those slots into your schedule, you could have the possibility of, you know, double booking an entire flu clinic. So it's really important that everybody works together as a team, but then at the end of the day, someone needs to hold this as their responsibility and do all the checks and balances to make sure that everything is going to work as smoothly as possible. So one of the first things you want to do if you do not own your property, so if you own your building and you own your parking lot, this is not much of a challenge. You might want to let your general liability policy know that you're going to be having a flu clinic in the parking lot. And your general liability, at least in Connecticut and most states that we've talked about this too, covers situations that happen in your parking lot. So if your patient falls and breaks their ankle in your parking lot, you're pretty much responsible for that. And I'm not sure many of you are aware of that. So you want to be sure that your general liability is going to be aware. You also want to let your landlord know for a couple of reasons. You know, one, you know, they're going to ask you for the face sheet of your general liability policy, even though they probably have it already. Our landlord asks for it every year, every other year. They want to know that you're maintaining your insurance. So they'll ask you for that. And then there's a license agreement. It's not very detailed. And basically, it's protecting the landlord from anything that happens, you know, with the patient encounter, which you would be responsible if something happened in your exam room as well. So we are going to post a sample of that license. Your landlord may not even ask for one. The other reason to discuss it with your landlord, what if someone else in your building is doing a health fair, or what if they were planning on relining the parking lot on the day you're doing your flu clinic? So it's important to have open communication. Many practices will do these on the weekend. Typically, many other medical practices, not necessarily pediatric, are closed. They don't have a lot of patients floating through. Sometimes if it's Saturday morning patients, you're free on Saturday afternoon to almost the whole parking lot, and again on Sunday. So communicating with your neighbors just to let them know that, you know, you're going to be providing this service is probably a good idea too. All right, so one of the first things you want to think about is safety first. Making sure that where you are planning on doing the drive-through in your parking lot is as safe as possible. So you want to do a diagram, you know, and sort of, you know, the workflow of, you know, how the car pulls in. You're going to need two stations, one sort of like the check-in station, which is, you know, an MA or an admin person can really do that, which is making sure that they're signed up, that they did sign up, making sure if you have VFC and private vaccines, we use a sticky on the car, you know, like orange means, you know, there's a VFC vaccine, you know, car. So you might want to do different things for the different vaccines. Some people only have private vaccine, so that doesn't really matter. But as you check in, the person who's checking in will be able to see that on the check-in sheet. And then, you know, now with COVID, you'd have to ask the questions, you know, the 4 or 5 questions that your practice is using. We're suggesting using an iPad if possible, if you have Wi-Fi in your parking lot. Our IT people were able to put a hotspot so that we actually can VPN into our EHR and be able to document and do these things real time. Or you know, when we didn't have that, we used the clipboard method, and the nurses would go back and document everything after the clinic was over. So also looking at technology and how you can best use it to be efficient in that perspective. So that's going to be one station. And then the second station will be the administration station, which is where the vaccine will be located, and the nurse who's giving the vaccine. So if you're doing one lane of traffic, you will need at least 2 people. And we'll talk about that a little bit more as we get into the discussion here. So what we're talking about here is the traffic pattern. So clearly you don't want to have cars lined up out into your main road. The best is sort of like, if you can think of a bank or a drive-through, you know, vendor, being able to sort of U-turn around to be able to have a few cars in place. This goes very quickly. So there's very little opportunity for things to get clogged up, unless, of course, people come late and other people come early. But as I said, it's a pretty fast process once the car pulls up. So we haven't really had any issues with like traffic, big traffic delays. Safety, we encourage, you know, the patients and their children, no one's getting out of their car. The first thing that one of your staff should say as they, you know, approach the car is the car in park, right? You don't want the mom turning around or, you know, talking to the kids and like she never put the car in park, and then, you know, the car is moving and might hit the car in front of it, or one of your staff actually. So we request people stay in the car. If the mom has to get out of the car to assist one of the children, we have them turn the car off. We do not want a running car while the driver is actually not in the driver's seat. So these are all things that you really need to think about and train the people who are going to be running these clinics to be aware of safety, which is something they have safety in the office for needles and things like that, but this is a different kind of safety. So you would want to make sure that they're very aware of that and you've had discussions with them. And then, you know, develop what the safety plan is. So if something happens, you know, who are they going to call? Make sure someone has their cell phone and it's charged so they have access to the office, or if you needed medical, you know, attention. Also, you know, we've had kids, you know, they faint after a vaccine. So making sure that, you know, you have your emergency care kit nearby, you know, with ammonia and epi and, you know, and all the things that you would have in the exam room. And again, you know, a live phone that works, that they will be able to speak to someone should they have an emergency or need additional help. So now that we've sort of gotten permission to do the clinic and we've reviewed, okay, where are we going to do it? You know, how would the workflow work in the parking lot? You know, where would the stations be? How do we schedule? How do we think about scheduling these? So choosing dates and times. So, you know, of course, making sure that you have adequate staffing, making sure it's not a busy time in your parking lot. And thinking about too, you know, looking back to last year or the year before, how many flu shots did you give that were not associated with a visit? So that would be a rough number that you could say for sure you would be doing as a drive up. We all know our sick visits are down. So those opportunities that you had before to give flu vaccine are probably not going to happen this year, as some of those visits are being done via telemedicine, if you're already doing telemedicine in your practice. So it's going to be a rougher estimate than maybe normal this year, which may end up being your new normal. So again, being very careful about, okay, how many of these clinics do we think? How many patients are we going to need to vaccinate between now and October 31st? And how do we get this job done? So we find that our staff can do 20 to 25 vaccines in an hour. Now, how do we do that? So there may be one car of 6 people, because we also do the parents, which is something you might want to take as an opportunity to make some extra money. We don't bill their insurance. We charge the patients cash. And the nice thing about that is the parents make this like a family trip. Okay, we're all going to go get our flu shot, mom and dad, and then, you know, then they go off and do something special. So we've been able to capture vaccinating some of the parents, and it's a nice added bit of change. At the end, I think we collect somewhere between $15,000 and $20,000 on private cash pay flu visits, which helps fund some things that we do with the staff. So thinking a little bit out of the box as well to capture some of those, which clearly this year more than ever, we want all the parents to get as many people as possible to get flu vaccine, because we don't know how it's going to cross over with COVID, and then trying to tweak out, is it flu, is it COVID, it becomes more of a challenge as well in unvaccinated people. So thinking about how many vaccines you have to give will allow you to think about how many of these clinics you need to run. And then in your parking lot, if you can handle 2 rows of cars, then you would need 4 staff, and you could do double the amount of vaccines. And clearly, this is much more than you could do. I don't think many practices can do 25 to 30 flu shots in 1 hour in their office. And then where would you put all these people? So, as you can see, I think that it's a pretty good situation if you have the means to be able to set this up. And then in scheduling, so we talked about volume. Let's talk about scheduling a little bit. So many of the EMRs do not allow online scheduling. And I'm sure the audience today, if we had a raise of hands, we all have different EHRs. So looking at your EHR and seeing how you can best schedule so that you're not having hundreds of phone calls come in to your staff to figure out where you can put all of these drive-up visits. So we have used for the last, I want to say it's the whole time we've been doing the flu, or maybe not the first year, but definitely for 15 years or so, Full Slate. So it's www.fullslate.com. It's an online scheduler, and it's pretty amazing. You can do up to 35 visits in 15-minute slots. It actually reminds the patient, it does the confirmation. So it also, does a lot of the sort of legwork that you might have been doing yourself. I guess the negative is that you open up the slots on Full Slate and you can put the link on your website. You have to then move it to your schedule. So basically you're blocking your schedule. So let's say this Saturday we were doing a flu clinic all day. That day would be blocked out for people to be able to put an appointment in if mom calls. However, when mom signs up online, that slot is then removed for availability, and someone in scheduling, you'll need to assign this to somebody, needs to move that appointment over then to the schedule. Which this is where you could get caught up if the staff are not working together or realize that, oh, I can't book a drive-through. The patient needs to go online and book it. Or if you are going to allow your staff to actually book some of those slots, they need to remove the slot first from Full Slate and then put them on the schedule. Otherwise, at the same time, some patient could be booking the same slot online. I hope I'm making that clear. So, using the tools that you have to best schedule. And on the first flu clinic, the first day you do one or the first weekend, I might book, instead of 25, I might book 15 or 18, just so that your staff can get used to the workflow. And it sounds a little bit overwhelming, I know, as I'm talking about it, but it really is very easy once you get all these details down and you have your checklists. So that's scheduling. And then pre-visit prep. So we, also put the pre-visit, the VIS for the flu, on our website. So like people can review these ahead of time. So that's not going to be a hold up during your flu clinic. You can list the pre-visit questions that they're going to ask, but asking a COVID-19 question online, and a lot can happen even if they filled it in last night. So unfortunately, you're still probably going to have to ask those questions. And I look at this as a major opportunity. If you have a staff person already moving over the visit from an online self-scheduling, go in and make sure that their their wellness visit, their chronic disease visit, their med check visit are really all up to date, okay? Because, you know, as you recognize, over the last 6 to 8 months, we lost a lot of visits along the way for a variety of different reasons. And some of these, you know, you might be able to schedule, you know, you haven't been in for 4 months for your asthma visit. Okay, so, you know, in addition to getting the flu shot done, you're now capturing visits that you had lost, and, you know, also looking at their other vaccines, like maybe they didn't get their second HPV at the same time. So that might be an opportunity to add those in as you are vaccinating the teenagers for the flu. And then also, you know, doing insurance verification, and this is the perfect opportunity if you have not been able to coerce your practice, your team, to have credit cards on file. This is the perfect opportunity. Everybody and their mother and uncle are making you give your credit card, contactless payment. So if you have not been able to succeed at that challenge, this would be an opportunity to get that done as well. So seize the opportunity. All right. So in terms of now, you know, you've figured out your scheduling, how you're going to do it. You're going to get some online software. You could do it the old way of calling in, but that's going to take up a huge amount of staff time. So you'd have to think about how that's going to work. We talked a little bit about having the open space and how to drive up. You know, using weekends. We also have done some evenings, like 5 to 7. But it gets, you know, we're on the East Coast, so it gets dark pretty early once October starts rolling in. So we don't get too much mileage because clearly we don't want to do it in the dark. But we have done it on Columbus Day. So many of the offices in our building are not open on Columbus Day. They close. So we have used that as a parking lot day. So you might want to think of some of those opportunities as well, like when is the parking lot not going to be busy. We talked about, you know, how many vaccines that you think you need to give. And, you know, if you could do 25 an hour and you're going to do a 4-hour shift, that's 100 vaccines. So how many shifts would you actually need? My staff, you know, they get tired after 4 or 5 hours. So if we're doing an all day, we have a second staff that comes in, you know, later to do the second 4 hours. I think it's hard to do more than 4 hours straight for 2 people without breaks and things like that. Again, you know, I have one nurse, she'll do the whole day herself, and, you know, she can do 30, 35 an hour, but not everyone can work that way. So you're going to learn too, depending upon the staff person and how organized and, you know, they are and efficient, you'll see who can take more and who needs to do less. And then whether we talked about a little bit, having some contingency plans for that. All right, so, you know, roughly if you have 10 cars and there's 2 or 3 people in each car, that's sort of where I came up with the 25 slots. So your schedule, you know, for full slate will be per patient, not necessarily per carload. All right, so, you know, you'll transfer it over and the nurse will know by family name, I suppose, how many carloads that is. So you can anticipate, you know, what the flow is going to be like. You know, do less in your first visit, like we talked about, a trial run. And then also in your, and we'll talk a little bit more about marketing and reaching out to your patients in a little bit, but be sure that you have something there written about what kind of clothing to wear. We typically didn't do less than 2, but this year we are. And we're going to, and actually the nurses, we've done a couple already, and the nurses were like, oh, this is so easy. The babies are in their car seat, you know, versus, you know, being on mom's lap and it takes a while, you know, they are pretty much already tied down. So they are feeling it's even easier for the younger ones, whereas before we were like, oh, the younger ones are probably harder. So I think making them wear, you know, either little snappy things or zipper things so they can open up their legs. And then in the older kids, you know, having a t-shirt, you know, a t-shirt so there's no sleeves or anything to have to deal with at the time. So we talked about a little bit about the scheduling, and I caution you to really think about this a lot and how that workflow would work in your offices. And it's really important that somebody maintain that full slate on a daily basis to make sure, one, that it captured the appointments that were scheduled, and two, that you have enough open slots available there, because you don't want patients going on the website to sign up and there's no availability there. So it will need to be monitored by somebody who can check it a couple of times a day, and then figure out on the weekend, who is going to check in, or you can just not engage it. You can shut it off on the weekend if you wanted to. So, but then you miss potentially people signing up. So you will have to decide within your own office, how that can be accomplished. So we talked about the VIS, so we have them review it online, and then when they pull up to the first station, we say, do you have any questions about the vaccine? There is no need to have patients sign for these vaccines. I know some practices do, but according to CDC, it is not necessary to have a patient sign for every single one of these vaccinations. All right, so we talked about this added step now where we have to screen all patients and accompany caregivers. So you can post the questions online, but again, unfortunately, it's not going to be usable, as they pull up, because who knows, they could have been exposed the night before. So I think, I would just suggest just doing it at the time of the visit. The patients are getting used to it anyway. We're asking them every time that they come in. I would suggest, though, if you do not have JotForm on your website, it is a really nice tool. It allows patients to fill out all kinds of forms. So if they need a daycare form, they can fill out the top part. We do not give forms out at the drive-thru flu clinic. We upload it to their portal after the clinic, because that would really hold the staff up. So it's a good way to see if they need a form for that visit. They can put the request there. It's great if your parents, you're going to do vaccines for parents, you can put the vaccine checklist, are you on any steroids? Do you have any, those usual pre-flu questionnaires that could be put online. Your registration form can be put there for the parents if they want to register themselves and give their credit card information. So again, it's less time consuming for your front staff to get all this information. It can be done very efficiently right from your own website. So this is, we talked a little bit about this before, and I can't emphasize it enough. This is a pre-visit checkpoint for missed visits. And this is an opportunity to get your practice all caught up. So I encourage you to have your front staff person spend the extra time looking at these visits that you missed or that the patient missed, to get everybody, up to date, and an opportunity to kind of fill up your telehealth schedules as well for some of these chronic care visits. All right, so the insurance verification, that also can happen from full slate. So as your staff are moving over the patient, they should check, the insurance verification, add the credit card. I mean, most flu shots are included in all insurance plans, so there probably isn't a lot of charging going on, but maybe they have a balance, or maybe they have a new insurance that you'll be able to do pretty easily online. All right, so the guest vaccination. So, we'll do, where we are, we have a lot of nannies, au pairs, because we have both parents are working. So we will do them as well, but they need to register as well. And they would need to put a credit card on file. As we talked about, doing the pre-visit questionnaires or pre-registration via JotForm, and then permission forms to give the vaccine. So this is all done before pulling up to the check-in station. So I'm not going to be super specific about the materials needed, because the CDC, if you go to cdc.gov/vaccine/healthcare providers, or HCP/admin/mass clinic activities, they do a phenomenal job of organizing for you what the supplies are that you would need to do an offsite vaccine clinic. and they give you very good guidelines. And they also talk about cold chain. So it's very specific how you manage the vaccines from your office refrigerators out to the parking lot and how it's maintained. So basically in the cooler is a thermometer, and the nurse who's giving those vaccines has to maintain and make sure. So you can use, you know, cold water bottles, ice bottles, but all the specifics are there on how to accomplish that. The good news is that none of these vaccines that we're giving in our parking lot are frozen, although when we did well care, the nurse would run up or somebody would run out the frozen vaccine at the time of delivery to the patient. So that gets a little tricky, but for flu, that's not a pertinent requirement for frozen. So I encourage you all to go to this website. They have a great list of all the supplies you would need. We got a metal cart, which you'll see in one of the pictures, I think, coming up, and everything is on that cart. We also have a red box that includes all the stuff for an emergency. So epi, Benadryl, things like that, ammonia, alcohol. So that, and an ambibag. So, you know, you can be prepared in case of emergency. It's never happened. In the 18 years we've been doing it, we've never had, you know, a untoward outcome. We've had some kind of, you know, kids get a little wheezy, but, you know, we have lollipops there. So we're giving out a lollipop. I know some of you will be like, lollipops, but we do it for a specific reason, that it does sort of help sometimes when they're feeling a little wheezy and they know that there's a lollipop at the end. And then, you know, looking at those lists, and again, your first clinic, you may not have thought of something that, you know, make sure you have an extra pair of hands, whether it's in the office or just somebody who's available in case they need something, because you don't want one of the two people that are running the clinic to be kind of running in and out. It will tie things up. So, you know, for the first one or for the first couple, just have a third person who can kind of be a runner or just be helpful to help the two staff that are doing it to kind of stay organized and on task. All right, so we're talking about cold chain, which is probably one of the most important things in this whole thing, is to keep the vaccine safe. So it will talk to you about what kind of cooler, you know, if the weather is really hot, you may only want to bring like a quarter or a half of your vaccines out and do a run-in midway through. If it's an all-day clinic, you know, you may want to have a second cooler ready to go, you know, bring one back and take another one. So I think it will really depend a lot on, you know, when you're doing it and how many you're doing it to, that will affect some of these decisions. But again, you know, this shows that, you know, the person who's sort of ultimately responsible for this, you know, has a lot of things on the checklist to make sure get accomplished. And clearly it's not a one-person job. So again, making sure the right people who are doing parts of this are very responsible for the responsibilities that they have. All right, so, you know, in talking, and there's the cart, you can see one of the carts. We typically, just to talk about the setup a little bit, we use a pop-up tent. And more because it delineates to the patient like where our station is. We also have orange cones that we put up that delineate where the car will pull up. You can get those at Home Depot. That's where we got ours. The cart is just a general, you know, medical cart that, you know, we have everything that we need on it. And you can see that that doctor, actually, that's a doctor, because that's when we were doing the telewell visits outside, you know, the follow-up part to the telewell visit was in full PPE, but you do not need full PPE for these visits. You need goggles and a pair of gloves. You do not need a gown and all that. At least right now, that's what the recommendation is. So in terms of staffing, you know, educating all the staff. The whole practice needs to know what's going on with these drive-through flu clinics. It's a new service. You want them to promote it. You want them to be able to talk about it. You can have it on your, you know, voice, you know, instead of music. Some of you play infomercials. You know, this could be one of your infomercials about the flu, but be sure that all the staff know what's going on in your practice. The setup we talked about, you can have a dry run just for setup, like, you know, go outside, put up your, we had 2 folding tables, one at each station, that had, you know, some clipboards, the iPads, you know, whatever they needed. We had 2 folding chairs, so in case they needed to sit down for a moment, you know, they had a place to rest. And then again, if it's raining, you know, we used, we had those yellow slickers that they wore. The nurses, my nurses were fine doing it in the rain. But again, if it's really rainy and windy, we're not going to be doing it outside. So, you know, having the setup for that as well. The pop-up tents, you know, you do not want to leave a tent up in your parking lot. And I know that there are many practices who have tents up because they're doing sick visits outside. You do need a town permit to leave a tent up. So I know one practice got cited for putting up a tent for public use without getting a permit. And the reason being, it's a safety issue. You know, if the tent were to come disengaged and be flying around the parking lot, it would not be cool. So we only put the pop-up tent up during the clinic, and then it comes right down. We do not leave it up in the parking lot for safety purposes. The intake station, you know, we talked about already, the person will be taking the temperature, asking the COVID questions, checking on the, you know, list of appointments for the day that they have been checked in. We do not do drive up, like a walk-in drive up. Like if they did not pre-register, you know, we kindly ask them to remove themselves from the line and, you know, sign up for one of the future clinics, because we don't have the admin staff there to be able to verify the insurance and all of the other things that we talked about that we're doing pre-visit wise. If you choose to do that, and, you know, and you have your computer out there, it's just going to hold up the line. So I would advise probably against that, at least for your first few, until you get a better handle on it. And then the administration station is basically your nurse, or I know in some states an MA can give the vaccine. And basically, you know, she knows who's in line, or the intake person will say, oh, I have the Smith family here, and we'll get the vaccines ready. We use the pre-drawn vaccine, so we're not drawing up vaccines. If you're going to be drawing up from a multi-dose vial, you know, you may want to have a few drawn up ahead of time, just to kind of keep up with the pace. All right, so this is a little bit more defined as to what's going to happen as the check-in. So as we said, the intake person, so this is intake now, the intake person will check in the patient and make sure the pre-visit information is all available and entered. That person will do the pre-visit COVID questionnaire, will take the temperature. We're using the CDC recommendation. Anybody 99.5 and over is going to get removed from the line. And I know people are like, well, that's not really a fever. Well, we had to put the cutoff somewhere, and just we went by what's recommended. If you guys want to use 100.4, it's just, you want to be consistent. So make sure the person taking the temperature knows what your cutoff is. The intake person will also advise the patient or parent to loosen the clothing if necessary. Again, making sure that, you know, the car is in park. If mom's getting out of the car, then she needs to make sure the car is turned off. And I can't emphasize that enough. And then collect any forms. So if the mom brought a form for school, you know, we're not giving it back, but we can collect it then, and it will be uploaded to their portal, you know, later that day or by Monday morning if it's on a weekend. All right, so the car kind of pulls up, you know, safety first, like we talked about. Depending upon the age of the child, may or may not need parental caregiver assistance. And I have to say, you know, the first year or two, this was tough. Once the kids, you know, did it once, it was not a big issue. We don't have kids screaming or carrying on. There are a few patients, you know, where that happened, and we basically have told those families, you know, probably not, you know, good idea for your child for a drive up. But my nurses, I can tell you maybe on less than one hand over the 18 years that they haven't been able to give a vaccine. So they've been really good about being able to get the job done. And then confirming the type of vaccine. Again, if you're doing private and VFC, you know, in this model, it might be a little trickier, maybe have separate coolers. to identify which patients are getting which vaccine. Then the nurse will confirm that the patient appears well. If the parent is getting the vaccine, the nurse does the parent first. And that's because by the time she finishes with the other kids, it's been a few minutes, and we don't want a woozy parent pulling away. If a teenager comes on their own and they are driving themselves, we designate 3 or 4 spots. Okay, pull over there for a couple minutes, and I'm going to check in with you before you drive away, especially HPV. And parents do send their kids to these alone. And that's fine, because if the parent signed the child up, we're okay that the parent is giving permission to have this done. But we do, especially for HPV, have them pull over for a couple minutes and just keep an eye on them and make sure they're okay before they drive away. And then, looking at that observation spot, so in your setup, and we didn't talk about this earlier, be sure you have a couple of observation spots where the nurse could look over and, like at least communicate with the driver. Okay, it's now you could pull away. And again, we have never had anyone faint, or, in the 18 years, it's pretty amazing. But, never say never, right? So we're always prepared just in case. Okay. So, for emergencies, I would, like you would in your exam room, review your emergency plan. So, the intake person is going to be the person who calls 911, or if you have office hours during that time, we'll be calling somebody inside the office to come out and give assistance. You don't want only one person staying at the site. You want the 2 people there so that the nurse who's giving the vaccine or attending to the patient has that second person there to be able to do things for them. And again, making sure they have a working cell phone available, and maybe that's part of your checklist for the day. Okay, cell phone charged, it works. Very important. And I think one of the biggest things, and this is kind of exciting, is that as you roll this out to your patients, you are going to look, wow, this is great. Our patients are really thinking about how to protect us. They're thinking of something new. I mean, they have all seen now in the news drive up COVID testing. So drive up medical care is not a very new idea to them. We've seen all over the news the lines to get your COVID test, sticking a swab in, as you pull up. So this is not a terribly new idea to most people. So use it to your advantage. Promote it to your families via portal messaging and email. You can add it on your website. You can use social media, post it on Facebook. Hey, look what we're doing. Be the first in your community to get the job done. You can blog about it. You can we'll do on the Monday following a flu clinic, we'll put a picture of a happy kid, and we ask the parent if we could post their picture. We always get permission first, so they get to see their kids, we don't put the name, we just put the picture. Having your own staff actually sell this service to them. So if they're calling for something, hey, do you know we're doing drive-thru flu? Please go online and sign up. So engaging your staff to promote it as well to your patients. Change your phone on hold message to announce the new service. We get mileage every year. The cable news channel comes, and because they see that we have it on social media, so we've gotten some mileage out of that. And you can use that as an opportunity to talk about flu in the era now of COVID, and how important it is to get your flu shot. And then you can put signs up in your office, on your computer screens, so you can get a fair amount of mileage and promoting your own practice. I think also with I think we've all sort of been down and out over these last few months. This is something new. It's something to get excited about, and I would use it in that vein. So you want to make sure too, now, we're talking about the post-clinic or a redux, basically, have a meeting on Monday with everyone involved in the clinic and how it went and what could we do better? What didn't we do? What didn't we expect? Make adjustments, to then the workflow and redesign your checklist. Then, as we said, advertise your success, add it to your Facebook or your social media. And then I would prompt a couple of patients to basically ask them, how did they like it? How was it? Is there anything they wanted to do differently? So engage them in the process. And you don't have to do it every single clinic, but if you're adding this new service to your practice, you want to be sure that it's being perceived in the way that you are delivering it. All right, so I know I went kind of fast, but there was a lot of material there, and I don't know, John, if you are collating questions at this point, but I really appreciate your time today, everyone, and so early too. I'm very impressed.
That was absolutely terrific. Thank you very much. It also had one of the things that I regard as a hallmark of a great presentation. There were indeed a laundry list of questions, and I don't know if you were paying attention to the chat box or not, but systematically you hit almost every single one in your presentation. We had questions about about vaccinating unestablished patients and mechanisms for that, or for getting them registered or insurance. You hit that. Questions about waiting in the parking lot, whether you did that, how you do that. One that came through from a few people is it was for a little bit of detail about how the heck you handle the young babies, really young toddlers. Do you have them in their car seat?
So yeah, they stay in their car
seat. Yeah.
Yeah, so they stay in their car seat pretty much. If there's a third row seat, it's usually the older kids. Like usually the car seat kids are in the second row. So in that situation, the nurse does ask the mom to bring that child forward. They are not climbing in the back of, Suburbans, let's say. Okay. And sometimes, those parents know to come twice. You have to use your judgment, but the nurses say in the car, because it's a more closed space, it's actually easier for them. And I'm happy to, if any of your nurses want to talk to my nurses, you guys can shoot me an email and I can hook you up. But they don't have the issues they have in the exam room. And I don't know what it is, if the parents are bribing them that we're going for ice cream or donuts or wherever they're, you have to be good in the car. It is very rare that the second person needs to go help the nurse administer the vaccine. Because even if they, they're in their seatbelt, one arm, whichever side of the car she's going to, it is pretty accessible, so we really don't have that much trouble. And I know people are like, oh, I don't believe that, but please believe it. It's a closed space. It's, they already know what they're coming to get done. It's not like a surprise. They know they're just coming to this drive up. And the kids are kind of a little excited too, because like, we're going to drive-through, like we go to McDonald's to get a flu shot, so they're kind of not aware as much what's happening. And as I said, once they do it, the first time or second, it really does not become an issue.
That is fascinating to me. It's probably a general principle for trying to do these things. In clinics, I think, scare people. One question that it came up as well, you dealt with this a little bit, a chronic issue in your clinic and everyone else's for regular work are walk-ins, walk-ups, people who come in and they didn't pre-fill anything, but geez, they really want in. How big a problem is that? How common, and how do you handle it?
All of our advertising about it says you need to sign up. Whether it's, the person on the phone is saying, okay, you need to go online and sign up. We have never done walk-in flu vaccines ever. So it would be an oddball thing for a patient to just walk in to get a flu shot. Now, if your practice has had that sort of policy before, you may need to do a little bit more education. But, I'm not saying you can't do it. It's just harder to verify everything. You could do it and verify later and hope that, everything was okay. But it will derail the flow, and especially when you're doing high volume vaccines, in a short period of time. It's going to upset the flow. And then the people who signed up are not going to have the best experience. So, you know, we put it in the perspective of, you know, if you want to come back at the end, you know, we'll be done at 2 o'clock, you know, something like that, you know, if you want to just offer something, but I think typically it would not be a good idea.
That's really helpful. Thank you. It's something that came up from one person, and I think that there are probably going to be several other people with requests for this. They're interested in whether or not it's possible to get access to your slides after the presentation.
Yeah, you can post them. I mean, Ariana has them, so yeah, no worries.
Fantastic. For the rest of you who are watching, there was a little conversation going on in the group chat as the talk was going on concerning scheduling, and there's some messages from Sarah and from Lance Cass about some online scheduling modules and software.
It's called Full Slate. So
Full Slate.
www.full-slate, SLATE.com is the one that we have used. There are others now these days, but I can't vouch for them as I can for Full Slate, so I'm not trying to make you vendor, you know, pointed, but we have been using Full Slate for a very long time and have not had any issues. And it's a HIPAA compliant platform. That's the other thing you want to make sure when you're scheduling patients for things that you have all of the HIPAA stuff lined up.
Okay. Well, I want to be mindful of everybody's time. It is 8 o'clock. This was outstanding. I really cannot thank you enough for doing this. And again, I think sorely needed. This has been a constant topic of conversation in different meetings because everyone recognizes it as a necessity, but where the rubber meets the road, nobody really has a sense for how to do it. And I think that this is the huge leg up that everybody needed. I want to thank you again. I want to thank everybody else for logging in this morning. I hope to hear from you again in the future because, again, I recognize and I want to emphasize to everybody else that this is one of many remarkable things that you've done and helped to promote.
Oh, thank you so much.
Thank you. Have a good morning, everyone.
Okay. Everybody have a good day.